Hey everybody, this is Dr. Clark Schierle with Northwestern Specialists in Plastic Surgery with 5 things that you didn't know about breast augmentation. So breast augmentation surgery typically involves placing an implant into the breast to enhance its volume. This can also enhance the shape, enhance symmetry. It's one of the most common procedures that we perform here at NSPS, as well as one of the most common procedures performed nationwide. Over 300,000 breast augmentations are performed annually in the US alone, according to statistics from the American Society of Plastic Surgeons, as well as the American Society for Aesthetic Plastic Surgery. 2 societies that we are members of here. The breast augmentation, despite being the most common procedure performed by plastic surgeons overall, is still something that we take very, very seriously. There is some sense, I think, that this is a little bit of a trivialized procedure, and all surgery is something that we take very seriously. We expect our patients to take it very seriously. Patient education is our #1 goal here. We feel like the educated consumer is our best patient, and that's part of our goal with this YouTube channel and helping to educate you to make an informed and empowered decision for your own health and well-being. So with that being said, let's get into it. #1, do I have to wear a special bra after the surgery? Well, this is something that is common in certain practices. We don't tend to use special shaping bras as much here at Northwestern Specialists in Plastic Surgery. The majority of our patients, as long as they have the appropriate anatomy and the surgery goes as expected, are going to be able to recover in some sort of ace bandage, or even a loose-fitting sports bra. We will give patients some guidance post-operatively, but the majority of our patients are able to get by with something that's comfortable, that provides a little bit of support, and helps to guide their healing process, and does not require a cumbersome post-operative garment that they may have heard about from some of their friends that have seen other practices. #2, I've heard some things about silicone breast implants. Is that the only option available? There are many options for breast augmentation. We offer silicone breast implants here at NSPS, along with saline devices that come in a number of varieties. You can also augment your breasts using your own fat alone. There are constantly evolving options for breast augmentation, breast implants. Our #1 implant at Northwestern Specialist Plastic Surgery is a constantly shifting landscape as newer technologies come out. We always feel like we're able to provide the best new technology for our patients. We do only offer FDA approved devices for our patients for general use, and as such, these are all devices that have been rigorously tested and are safe for use. I can honestly tell you that I would feel comfortable performing this procedure on any member of my family, and I wouldn't have it any other way. I'm a doctor first and a cosmetic surgeon second. It's important to discuss your options with your board-certified plastic surgeon at your consultation so that they can make the best choice for you in terms of what's going to work best in your particular situation, your anatomy, your goals, and so forth. #3, do I have to have a scar on my breast? This is another common misconception. So we here at NSPS specialize in what's known as the transaxillary approach for breast augmentation, which is through the armpit. This allows you to avoid any scarring whatsoever on the breast itself. Many women do feel that a scar on the breast does alter the aesthetics of the breasts, particularly moments of intimacy with their partner where they may be laying back and the scar may be more visible. And as such, we like to be able to offer this option to our patients. It is true that the inframammary scar does provide a very good approach, which is very straightforward and is the most commonly performed approach nationally. We offer this approach as well, and it's something that we are also very comfortable with. A similar dissection, similar recovery, and similar result can be achieved regardless of which approach you take if you go to a board-certified plastic surgeon who is experienced in all of these different techniques. So it's important to discuss your goals, the pros and cons of each approach with your plastic surgeon before making a decision on how to get your breast implants into your breast for your breast augmentation. #4, I don't want breast implants because they're going to look really fake. A lot of our breast implants do look very natural. Here at NSPS, we specialize in a natural look that is slightly enhanced, but still really does look very natural, does not have that fake stuck-on appearance. There are a number of modern techniques that we utilize, including dual plane submuscular techniques, modern techniques of tissue assessment, tissue planning, implant selection. All of these do help to provide our patients with the best possible result, and many of our patients are able to achieve a very natural result where some of their friends at the gym that see them naked when they're changing won't even be able to tell that they've had anything done. We're able to provide you with a customized look that will help you achieve your goals. If you are looking for something a little bit more enhanced, we can certainly achieve that as well. It's important to help you understand what you're going to look and feel like, and we take the time during our consultation to make sure that you understand that as well as possible, utilizing all the technology available, 3D, visual planning, gel sizers, as well as little things that you can do at home to help understand what to expect. All of this helps you to decide the particular implant that's going to give you the look that you're going for, whether it's a little bit more natural or a little bit more enhanced. Number 5, am I going to be unable to do any heavy lifting for 6 weeks? This is another common misconception. With modern surgical techniques, we do recommend that patients take it easy for at least a week or so. If you're a mom with small children at home, you might want to get a little bit of extra help around the house during that initial post-operative recovery period, just because that is going to be a little sore and a little bit challenging in terms of any heavy lifting in that first week or so. After the first week or two, enough healing has occurred that if you're doing something that's not good for the recovery, it should cause some discomfort. And so it's important to listen to your body and don't do anything that hurts. This goes for intimate activities, it goes for heavy lifting, as well as lifting small children. And so these are things that can be done safely if you're careful and don't do anything that hurts. Well, that's been 5 things that you may not know about breast augmentation. I'm sure there's a lot of other questions that you have. If you do have something we didn't mention, please leave a comment below. Make sure to subscribe and hit that little bell to be notified when we post new videos, and take care.
Hey guys, thanks for watching our video. Make sure to subscribe, follow us on Instagram, Facebook, and Twitter, and check out our next video.